As you reach for your morning coffee, have you ever felt your hand tremble? The back of your neck feels stiff, and turning your head becomes uncomfortable. Your arm begins to tingle, and the feeling in your hand slowly fades. At first, you brush it off. Maybe you're just tired. Maybe you didn't get enough sleep. But your body is already sending clear signals. The cause of the problem isn't something you can easily see. Let's reveal the real culprit. Deep inside your neck, between the bones, lies a tiny structure less than 1 centimeter in size, the disc. The neck is made up of 7 bones, connected by 6 discs in between. These discs support the weight of your head and absorb the shock created when you move. Let's take a closer look at the structure of the disc. A single disc is shaped like a short cylinder, measuring about 3 to 5 millimeters in height, with a tough outer ring called the annulus fibrosus and a soft inner core known as the nucleus pulposus. Much like a Boston cream donut. Under normal conditions, this donut acts as a protective buffer along the neural highway, absorbing impact with every movement and keeping the road stable so signals can travel smoothly. But when you spend hours looking at your smartphone or maintain poor posture, things begin to change. Tiny cracks form in the outer layer of the donut, the annulus fibrosus, and the soft inner cream begins to push outward. The problem is the direction that cream moves. It's as if it has invaded the roadway. The road isn't completely blocked, but it becomes increasingly difficult to pass. The pressure on the nerve increases, and signals from the brain no longer travel smoothly. That's when symptoms like tingling, pain, and weakness begin to appear. In the early stages, medication or physical therapy can be used to manage the condition, essentially maintaining the road. But if the compression continues, the situation changes. The longer the pressure persists, the longer recovery takes. And in some cases, full recovery may not be possible. At this point, we need to decide. One approach is to open the front of the neck widely to address the entire area. Another is to create a small 1 centimeter pathway and precisely remove only the root cause. We choose endoscopic decompression, a precise solution developed through advances in contemporary medicine. The inside of the neck is an extremely narrow and sensitive space. The nerve runs right beside the affected area, and even the slightest disturbance can worsen the symptoms. That's why, in this area, precise access is far more important than making a large incision. First, a tiny 1 centimeter opening is created at the back of the neck. Then, an endoscopic camera is slowly inserted through that pathway. This approach minimizes scarring while taking the shortest route to just behind the affected area. The surgeon then uses an ultra-precise drill to carefully shave a small portion of bone, just enough to clearly visualize the problem site. Next comes the most delicate step. To avoid injuring the sensitive nerve, the nerve is lifted slowly and gently upward. This step creates enough space for the endoscopic instrument to pass safely around the nerve. Without disturbing the surrounding structures, only the displaced disc fragment is precisely grasped and safely removed. The nerve that was compressed by the disc returns to a state free from pressure. This is endoscopic decompression, performed through a passage just 1 centimeter wide. A return to daily life. Not all symptoms disappear immediately after surgery. But the flow of signals begins to change first. On the outside, nothing appears dramatically different. But what has changed is undeniable. The small obstacle that once pressed down on the neural highway is gone. The road regains its space, and strength naturally returns to the hand that lifts a cup and the fingers that tap on a keyboard. and your daily life quietly begins to move forward again.